When your cat was young, a little vomiting probably didn't worry you much. Cats eat weird things. They eat too fast, and every so often it comes back up. No big deal. But once your cat hits her senior years, around age 11 and up, vomiting that keeps happening isn't just a quirky habit anymore. It's her body telling you something. Chronic vomiting in an older cat is almost always a sign of an underlying health issue, or her digestion simply slowing down with age. And here's the thing every cat parent needs to hear. Regular vomiting is never just part of getting older. It's not normal, and it's not something to shrug off. We're also going to walk you through something a lot of owners mix up: the difference between vomiting and regurgitating. That distinction actually matters a lot, and we'll break it down for you later in the video, along with a simple guide to what different vomit colors and textures can mean. But first, let's get to what you actually came here for. What to do when your senior cat is throwing up. Your first move: don't panic, but pay attention. Here's the good news. Your cat isn't trying to make your life difficult. She's communicating with you the only way she can, and your job right now is simply to notice two things: when it's happening and what it looks like. Call your vet immediately if you see any of the following: vomit that's red, pink, brown, or looks like dark coffee grounds, no matter what time of day it happens. Retching or vomiting more than twice in 24 hours. Your cat refusing to eat for more than 24 hours. These are not wait and see situations. They need a same-day call. Book a checkup with your vet soon. If your cat is vomiting more than once a month, it isn't a hairball, and it doesn't match the emergency signs we just talked about. It's easy to brush this off, especially if she seems otherwise fine, but please don't. This is exactly the kind of thing that's worth catching early. While you're keeping an eye on things, jot down when it happens and what it looks like. That little log is genuinely one of the most useful things you can hand your vet. It turns "she's been throwing up sometimes" into real information they can act on. Now, if your cat's vomit is yellow, greenish, or a white foam or liquid, the timing of day tells a surprisingly clear story. Let's walk through what it might mean and what you can actually do about it before your vet visit. Morning vomiting. Here's what's probably going on. Her stomach has simply been empty for too long overnight, and the acid buildup has started to irritate it. What can help? Give a small snack right before you go to bed, or set up an automatic feeder to dispense a bit of food in the early morning hours. Stir a tablespoon of warm, unsalted bone broth, no onion or garlic, into her food or water. Skip the big breakfast. A large meal on an empty, acid-irritated stomach can actually trigger vomiting on the spot. Instead, offer one small bite as soon as you wake up. Let her stomach settle for 20 to 30 minutes and then give her the rest of breakfast. Nighttime vomiting. Here's what's probably going on. Too much time is passing between meals during the day, so acid and bile build up and irritate an empty stomach. What can help? Move from 2 big meals to 4 to 6 smaller ones spread throughout the day. An automatic feeder makes this easy. Raise her food and water bowls 2 to 4 inches off the floor. Many senior cats have some arthritis in their neck or spine, and eating with a lowered head can be more uncomfortable than it looks. Switch to a wide, shallow dish or a slow feeder. If she's a fast eater, she's likely gulping air along with her food, and a flatter dish naturally slows her down. Add more wet food in the evening. It's gentler and easier for her to digest overnight than dry kibble. Warm her wet food slightly, about 3 to 5 seconds in the microwave until it's close to body temperature. It's easier on a sensitive stomach, and the smell alone can help her digestive system kick in properly. Daytime vomiting. Here's what's probably going on. If she's throwing up several hours after breakfast or after a midday snack, this usually points to something different. Her stomach may be emptying too slowly, or there could be a food sensitivity at play rather than a simple empty stomach issue. What can help? Leave a solid 3 to 4 hour gap between breakfast and any midday snack, so her stomach has time to fully empty. Try a puzzle feeder to naturally slow down how fast she eats her kibble. Spread wet food across a flat plate or textured lick mat instead of piling it into a deep bowl. Look at the ingredient list. A lot of everyday kibble is heavy on corn, wheat, or soy, which can be harder for her to break down and may cause low-level nausea. Consider a novel protein, something clean and simple she hasn't had before, like duck or rabbit. Can be gentler on her system. A quick but important note. Even the best food in the world can cause vomiting or diarrhea if you switch too fast. Take it slow. Transition over 10 to 14 days. For example, days 1 through 3, 25% of the new food, 75% old food. Days 4 through 7, 50-50. Days 8 through 10, 75% new food, 25% old food. Day 11 and onward, 100% new food. And go easy on the rich treats. A lot of store-bought snacks are heavily processed. Freeze-dried, single-ingredient treats like plain freeze-dried chicken is a great option and a much gentler choice. Vomiting or regurgitating. Here's how to tell the difference. Before you pick up the phone for your vet, it really helps to know which one you're actually dealing with because they point to two very different problems. Vomiting is active. You'll usually see it coming. She might pace, lick her lips, or drool. Then comes that unmistakable heaving sound as her whole belly works to bring it up. This means her stomach or intestines are actively pushing food or fluid back out. Regurgitation, on the other hand, is passive. No warning, no heaving, no drama at all. She might just be walking across the room, lower her head, and out comes a tube-shaped bit of undigested food, usually right after eating. This isn't a stomach problem at all. It means the food never made it past her esophagus in the first place. And here is a handy guide as a reminder of what to look out for. What has worked for your senior cat? Go ahead and drop your tips in the comments below. The more we share with each other, the better we can all take care of our old friends.